Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Norma Basalis. So let's start our topic with introduction. Norma Basalis refers to inferior view of skull. It shows the external base of skull and is divided into three regions: anterior region, middle region and posterior region. This view is especially important for understanding foramina, canals and muscular attachment related to cranial base. Division of Norma Basalis. The base of skull, as seen from below, can be divided into three regions as we stated earlier. Anterior part, that is from hard palate till the alveolar arch. Middle part, that is formed by sphenoid bone and temporal bones. And posterior part, that is formed by occipital bone and surrounding structures. Now let's talk about these parts one by one. So first we will talk about features of Norma Basalis in the anterior part, that is also called as hard palate region. Then we will talk about middle part, that is also called as sphenoid and temporal bone region. And then we will talk about posterior part, that is also called as occipital region. So first region is anterior part, that is hard palate region. It is formed by palatine process of maxilla and horizontal plates of palatine bone. Important features here include incisive fossa with incisive foramina, greater and lesser palatine foramina at the posterior lateral angle, alveolar arch that contains socket for upper teeth. Then we will talk about middle part, that is sphenoid and temporal region. It is formed by sphenoid and temporal bones. Key features include vomer that is seen posteriorly in the midline articulating with sphenoid bone. Second key feature is medial and lateral pterygoid plates of sphenoid bone. Third feature is pterygoid humulus, that is hook-like projection of medial pterygoid plate. Fourth feature is foramina in this region that include foramen ovale, foramen spinosum, foramen lacerum, external opening of carotid canals. Foramen ovale transmit mandibular nerve, foramen spinosum transmit middle meningeal artery, foramen lacerum transfer is mostly filled with cartilage in life, so it does not transmit anything most of the time except for emissary vein in cases. And then there is external opening of carotid canal that transmits internal carotid artery. Next feature of the middle part is styloid process, that is basically a slender projection for muscle and ligament attachment. Next feature is external acoustic meatus, that is opening of ear canal. And then we have is mandibular fossa that articulates with condyle of mandible from the temporomandibular joint. Now let's talk about posterior part, that is also called as occipital region. It is This part is dominated by the occipital bone, and important features here include foramen magnum, that is large opening for medulla oblongata, meninges and vertebral arteries. Occipital condyles that articulate with atlas, that is C1 vertebra. Hypoglossal canal that transmit hypoglossal nerve, that is 12th cranial nerve. Jugular foramen that transmit internal jugular vein and cranial nerve number 9, 10 and 11. And then there we have external occipital crest that extend from foramen magnum towards the protuberance. Then we have external occipital protuberance, that is posterior midline projection. And nuchal lines that are superior nuchal lines and inferior nuchal lines that are attachment sites for neck muscles. Clinical significance of Norma Basalis. First is foramen magnum, as foramen magnum is crucial in neurosurgery and radiology for assessing craniovertebral junction anomalies. Second significance is occipital condyles, as they are important in skull-based surgeries and in craniocervical stability. Third significance is carotid canal and jugular foramen, as they are vital for vascular and cranial nerve passage. Fourth significance is hard palate, as if there are any abnormalities in hard palate, it may cause congenital defects such as cleft palate. Fifth is that the knowledge of foramina and canals in Norma Basalis is essential for surgical approaches and understanding pathways of infection or tumor spread. Conclusion of this lecture video. Norma Basalis gives the inferior view of skull, showing critical anatomical structures divided into anterior part, that is hard palate region, middle part, that is sphenoidal and temporal bone region, and posterior part, that is occipital region. It is of great importance in anatomy, neurosurgery, dentistry, and clinical diagnostics due to presence of numerous foramina, canals, and muscular attachment. And this was all about Norma Basalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.